Good evening, everyone. Welcome to Optima Facebook Live. Every month, we talk about very interesting and useful topic to the general public. So today, we have a very interesting topic, uh, which is about a very important organ, which we are which we tend to abuse nowadays a lot. So our eyes are important for us to see this world, but for eyes to function clearly, we need it to be wet and it to be smooth. And tears play a very important role in keeping our eyes very functional and useful and comfortable for us. But there are conditions where this eye tear production is reduced and it causes dry eye. And many of us may be suffering from this dry eye symptoms, especially in this day and age with a lot of use of screens. So today we are going to discuss about this dry eye disease. And to discuss this important topic, we have with us um, consultant ophthalmologist, Dr. Aditya Baragali. Thank you, Dr. Aditya, for joining us
Yeah, you're
and
welcome,
welcome to
Vijay.
this show.
And it is pretty straightforward. All of us are on our screens looking at your live podcast. So,
Yes,
one of the crucial thing is many of us believe that just a sign of discomfort itself is dry eye. It is partially true. So, in a way, most of the parents tend to tell their children that try to decrease your screen time, you will get dry eye or you will get some other issues. There is some truth to that. But at the same time, the same parents who are engaged in IT work or many other professions, especially even now, even in legal matters in chartered accountants' offices, they are using screens, multiple monitors, even animation up to 12 to 18 hours in a day. So, dry eye has become more common than it was before because our previous generations, the parents and all, whenever those who used to work in banks, they used to have ledgers and books. So even when computers came in, it was not a full time, occupation. So nowadays, staring consistently at the screens has definitely increased dry eye. So I'll just you wanted to ask
yeah,
me something.
yeah, Dr. Aditya. Thank you so much for setting the ball rolling. So, but what exactly is this dry eye and how common is it? You said that it is increasing now. How common is it in the general population?
I'd like to share a small to say uh, presentation.
Sure.
I'll begin with a little bit of general information regarding dry eye. So, can you see the slide?
Yes.
Yeah. So, if you look at it, the front of the eye is covered by this bluish colored fluid layer called the tear film. The eyelids are there in the upper and the lower region. They secrete a oily kind of a layer, and in between there is water which is secreted by the lacrimal gland. So we tend to believe that tears is just salt water. Most of us, uh, you know, tend to believe that it can absolutely be replaced by any other fluid, but it is not. It's a physiological mixture of many components. So, coming to your question, dry eye is a chronic inflammatory condition which is an interaction between the environment and the person more commonly. So the geographies and the climatic regions which have more dryness or less ambient humidity, more direct sunlight tend to have more incidence of dry eye. Asian studies report anywhere between 18 to 36% of their population suffering from dry eye in the working age group, that is between 18 to 60. So it is a very common problem.
Sure, absolutely. I mean, most of the audience will agree to that. That dry eye is pretty common. So, what are the common causes of dry eye, which you come across in general practice?
So the common causes of dry eye would be a environmental condition where they are working in places or industries where just a second, I'll just yeah. So this is the important. The common risk factors would be the middle-aged and elderly population. So the men who are working in certain industries where there is a lot of heat, like chefs, those who are working in foundries and manufacturing units. There are people who are into marketing and sales who need to travel from one location to another location. In women, it tends to occur more commonly in postmenopausal state and in those who already have PCOS or in dysthyroid state. It also occurs in certain cases where patients are undergoing hormone replacement therapy for other reasons. The other common issue is tobacco has been known to cause dry eye through multiple pathways. It is known to increase inflammation in the body. It increases the chronic inflammatory factors. It decreases the amount of tear production by its cholinergic pathways. There are a few medications also which can cause dry eye.
Okay. Okay. So, yes, please continue.
Yeah, you wanted to ask me the question.
Yeah, so you said about all these causes. Now there are many environmental factors which is causing dry eye, and you said certain medications which causes dry eye. So, are there some common? I think you come to that. What are the common medications which
Yeah.
people tend to use generally, which can be responsible for dry eye?
See, one of the chief issues that we face is many of the medications are available over the counter. We do not look into their other effects in the body and then tend to continue it without consulting the physician for how long it has to be taken. So, commonly, uh, the medicines which affect the secretory activity in the body are the ones that can predispose to dry eye. They don't cause dry eye, they can predispose. So,
Okay.
people have acne, which is a very common peripubertal problem. So, acne medications tend to decrease and alter the type of secretions in the skin and in and around the eye, especially. So, acne medications are known to cause evaporative dry eye because the lipid layer of the tears is not properly secreted. Some antihypertensives also cause dry eye. Those non-specific diuretics also which are there, like we use commonly Lasix. So Lasix can cause dry eye because it removes fluid from the body. Osmotic treatments, chemotherapy medications. See, these are all rare, medications. Hormone replacement therapy in the setting of other malignancies. Oral contraceptives because of their hormonal uh, effect, pain relievers, Parkinson medications, and a few gastrointestinal medications which decrease secretion. Pantoprazole seems to be the most commonly implicated one, but it is an anecdotal evidence. There is no randomized control study to support this, but we have seen patients using that over the counter. So we also tend to see people having dry eye.
Okay. So apart from lot of substances in the environment, medications, very common medications as you put across, can cause dry eye. Uh, so these are causes which is external. Is there any internal, like an immune mediated, like, because I'm an immunologist, rheumatologist, and I'm interested in this, that uh, what are the immune mediated causes for dry eye? How can our body's immunity itself lead to dry eye?
So the immune causes of dry eye are mainly because there are certain diseases which you will be explaining, which can damage the cell membrane, which can damage the underlying lining called as basement membrane. Commonly, we see that cellular damage is there in Sjogren syndrome. In rheumatoid arthritis, it tends to be the lining damage. SLE, scleroderma, and graft versus host disease in patients who have undergone transplants, they also have certain medications which can cause the dry eye. But here there is a very strong underlying cause.
Okay. So, I mean, we commonly see, as you put across, a lot of patients, especially for Jogren, this is our first sort of thing which we ask patients: do you have symptoms of dryness of eyes or itching in the eyes or something, feeling of falling or gritty sensation in the eye? But a lot of the other diseases you put across, rheumatoid, scleroderma, etc., dry eye is a very common symptom, and it's a very difficult symptom because management of that is not very, very satisfactory. Uh, from our side. But yeah, just moving on. As you said, we have discussed about environmental factors, medication factors. immune system, autoimmune diseases causing dry eye. Um, but can someone, how can you tell someone whether his dry eye is because of what environmental factors or any other autoimmune causes? How do you differentiate that? You're in mute.
Yeah, sorry. Yeah. So, very commonly, what happens, the inciting factor for dry eye is the one that decides whether the patient is having an internal issue or a environmental issue. So, commonly, just a second, huh? Just give me a.
Okay, so just to recapitulate, I think we were discussing the dry eye disease with Dr. Aditya Brigali, a consultant ophthalmologist. And this is a very common symptom which people are suffering from nowadays. And we have learned so far that the eye tear production can be affected in many ways. And we looked at three main causes. One is environmental factors, medications, and third is autoimmune diseases. So these are the three factors which are responsible for dryness of eyes. We're discussing further with Dr. Aditya how to differentiate between environmental as well as immune system related factors.
So, what happens is, if we take the example of somebody who has a immune mediated dry eye, the symptoms tend to vary with their underlying systemic issue.
Okay.
There are complaints of joint pain or psoriatic issues. All of these will be waxing and waning, and they will have a proportional dry eye complaint.
Okay.
Now, when we come to environmental or a patient's, it is called external dry eye.
Mm-hmm.
So it happens in very specific settings. If
Mm-hmm.
we take the example of an industry worker, it happens on the days where he goes to the work. He is in a foundry or in a glass manufacturing unit where there
Mm-hmm.
is a lot of heat. It doesn't happen inside the house.
Okay.
If we take the example of a housewife or a woman who's an IT professional, it will have waxing and waning along with their thyroid profile.
Okay.
So, children also can have dry eye. It will happen. Most of us we have seen when we drive two wheelers, or if we are not wearing adequate protection, there is dryness in our eyes, and then it starts tearing by the end of our journey.
Okay.
So, the specific relationship to their underlying systemic disorder is the one that decides whether
Mm-hmm.
they have external dry eye or autoimmune dry eye.
Hmm.
And
Now coming
also,
back, yeah, please
uh,
continue.
in the cases where patients are taking methotrexate or cyclosporine, their
Hmm.
dry eye, even without tear substitutes, improves significantly.
Mm-hmm.
I mean, provided we don't have such a bad summer as we had this year. So, that if the environmental component is completely negated,
Okay.
just treatment of the autoimmune disorder helps the patient's discomfort to improve significantly.
All right. So, I mean, just coming back to one point you talk about children. So now one important, I think, question in everybody's mind is we talked about screen time also. Uh, how does screen time or using screen time uh, worsen your dry eyes?
So, the important thing is in the screen time, there are two major issues.
Okay.
One, our blink rate comes down. Second
Hmm.
thing is there are spots of dryness forming on the cornea when the tears are evaporating. So the mucus which is lining the cornea helps the cornea to get completely wet. So whenever the screen is used for a longer period of time, there are persistent dry spots on the cornea which become dry faster. There is a test which we use clinically called as tear film breakup time. So we
Hmm.
stain the tears with help of fluorescein and we look, there is a consistent dry spot on the cornea always.
Hmm.
So screens of any type, it doesn't matter whether it is a TV or a computer or a phone. So because it decreases the blink rate, even with normal tear physiology as well as blink rate, the evaporative dry eye is what results. That is the reason why we tend to tell people to use the 20-20-20 rule that is famous as
Okay.
You need to.
What is the rule?
So the rule is for every 20 minutes of screen time,
Hmm.
you have to look away at a distance for 20 minutes. It is not very practical. We tend to tell patients to look away, get up from their desk or
Hmm.
whether their workplace and move around for about 5 minutes, or you can close your eyes. The second modification most of them do is to avoid sitting facing the draft, whether it is in your vehicle or in your workplace. Sitting facing an AC vent or a
Hmm.
fan makes it very cool and you feel better after you enter from a sunny place. But the issue is it also increases the evaporative dry eye.
Hmm. Yes, that's the reason many in the office spaces, especially software professionals, complain of dry eyes. Obviously, the screen, and second things, I think the environment, the room and the AC also makes a difference. Now, we talked about the various causes of dry eye. We understood what is dry eye. So, how do you, in practice, um, objectively measure whether the patient has dry eyes? How do you say objectively? Patient will complain of symptoms, very vague symptoms, but how do you objectively say that patient has a dry eye?
So the two standard tests that are done in the OPD are tear secretion rate and
Okay.
tear film breakup time.
Hmm.
So more of late there are infrared mammography. So there are other tests which are slightly more advanced. But
Hmm.
commonly speaking, if the tear film secretion rate is
Hmm.
normal
Hmm.
and the breakup time is greater than 10 seconds, the person is more or less normal, and the dry eye is mostly because of environmental and lifestyle.
Hmm.
So ideally, uh, only when the patient complains of a consistent discomfort or dryness at a particular activity do we do these tests. They are
Hmm.
generally not part of the comprehensive eye checkup that happens once every 6 months.
Hmm.
So it is a compulsory thing if, let us say, you refer a patient of Sjogren's or rheumatoid arthritis, it is done as part of their workup because we want to understand how the disease is affecting the surface, ocular surface in
Hmm.
general.
Hmm.
So only then it will be a consistent part of a checkup.
Hmm. Hmm. All right. So there are certain tests which you can do, except as you alluded to, that is your tear breakup time and the Shermer test and the
Yes.
ocular staining score, etc., which you do, especially in patients which we refer for in like Sjogren's when we have suspicion of Sjogren. Um, Now, Dr. Aditya, now we understood there are ways to measure it, but what are the ways where how can somebody with symptoms of dry eye, which you have objectively identified as having dryness, um, how can we help them without, say, non-pharmacological as well as pharmacological to help improve their symptoms?
So the most important thing in the lifestyle and behavioral modification, what we would like to do is first is to make sure you blink adequately whenever you're using a screen.
Okay.
Take a good amount of rest in between prolonged computer or screen related activity.
Mm-hmm.
Commonly, with IT professionals, if there are certain meetings where they have not much of data to visualize or they don't have to keep their video on, they can take the call with their eyes closed because
Mm-hmm.
the meetings after that, my wife is an IT professional, so these are the things we do at home.
Mm-hmm.
Then the 20-20-20 rule, it is a little difficult to do because you might be in the middle of something very important.
Correct.
So the thing is to make sure that you avoid coffee and tea more than, let us say, 2 or 3 cups in a day because they
Mm-hmm.
are diuretics. They remove the water from the body. So they
Okay.
make the tear actually hyperosmolar. Even if you have normal thickness of tears, they
Mm.
become, to make it more simpler, they become very salty. So the
Mm.
mucus layer starts getting damaged. So the
Mm.
wettability of the corneal surface also decreases.
Okay.
So a person essentially has normal tear secretion, suddenly has dry eye, despite working from home, despite maintaining all the 20-20-20 rules.
Mm.
Those who work in very hot environments
Mm.
generally are given, especially industrial workers, are given protective glasses.
Hmm.
We always make it a point to inform them to use them. Many of us don't stress on the fact enough, not just for dry eye but also for injury. So, in women, commonly, the one of the things that we have seen, not just in women, in generally in people who work within AC environments, we don't feel thirsty. So the general hydration of the body starts coming down. So proportionately, the tear secretion and its chemical nature also changes. For that reason, you have to make sure that you set an alarm or something and have adequate water. So we have to prevent dehydration, whether by drinking more water or avoiding coffee and tea, rests and blinking exercises, and environmental adjustment so that you don't sit in facing a wind draft.
Yeah, that's very useful. I think a lot of the audience will be able to use these techniques at home and obviously try to reduce or help their dryness. Uh, when does one need treatment, or does everybody need treatment? Is the question.
So the dry eye disease score, most of us will actually be positive for dry eyes,
Okay.
but it will not be consistent.
Okay.
So the thing is, on hot summer days,
Hmm.
I think both of us have very clearly experienced this. After the children, as children, when we used to play cricket, come back home and you close your eyes, you'll feel hot and burning sensation will be there.
Hmm.
That is because of the hyperosmolarity of the tears. So that means that you have to drink water.
Hmm.
Commonly, the person who has a tear film breakup time of less than 10 seconds
Hmm.
and who is, despite having all lifestyle modifications, having complaints, only then we would suggest a you know uh, tear substitute or a lubricating eye drop. Treatment, as in, there are specific treatments which would be instituted for patients who have other autoimmune or medically caused dry eyes. So that pharmacological treatment is quite rare. So,
Hmm.
say for example, in a patient with Sjogren's, we might need to start cyclosporine to combat their very severe dry eye. They are almost dependent on it, despite the season being, no rainy season is almost here. So most of the people who experience dry eye as part of their daily routine will actually improve from May to, let us say, September or October.
Hmm.
But the people who have autoimmune issues, who do not have enough secretory activity, are the
Hmm.
ones who will be dependent on both tear substitutes as well as secretocoques.
Okay. Okay. Yes. So, I mean, we have discussed from the start what is dry eye, what are the causes, what are the, how do you diagnose dry eye, what are the ways when you start treating, lifestyle changes made at home, what are the, what, when to take medication. So, yeah, for somebody at home or somebody as a professional, should they see a specialist as soon as they experience dry eye, or when should they specifically say this is the time they need to see a specialist for dry eye?
Uh, as I said, seasonally, once the one thing that I think I missed telling was, we have a lot of screening tests in the way of the corporate health checkups. One
Okay.
of the things that we have noticed anecdotally is vitamin deficiencies
Mm-hmm.
and their type of diet and nutrition, especially with a marginal change in their lipid profile itself,
Mm-hmm.
tends to alter the tear constituents.
Okay.
So when we set this right, it takes a little time, let us say anywhere between 6 to 8 weeks, 2 months, for them to feel all right.
Mm-hmm.
So you can mention in passing to your eye physician that you have this kind of a complaint, but also make sure that you do a little bit of homework and see if it is consistently present on even off days, or if
Mm.
it is related to certain activity. See, like, there are professionals who also play sports, so they
Mm.
go to basketball or swimming. So in swimming it is not expected to be there,
Mm.
but highly chlorinated water can also cause a chemical dry eye.
Okay.
So all of these factors, for some reason they might have missed swimming or they might have missed to play cricket or basketball. If they are better on those days, it is better that you mark those days in the calendar. So you will start noticing the pattern. Only those who have, many times it so happens that very severe dry eye in thyroid eye disease and in Sjogren's is first noted by the ophthalmologist, because the patient continues to have complaints throughout the year,
Hmm.
because we are not treating the underlying cause.
Hmm.
Then you come into the picture, and then we start to understand where we are missing the underlying cause, and uh, major discovery is made. So that is the reason why better to avoid over the counter lubricating eye drops. They're extremely easily available.
Hmm.
So drink water, make sure your vitamin deficiencies are addressed, have a little bit of lifestyle modification and see if it improves. If it doesn't, then ask the doctor to look at your tear film or do the dry eye evaluation. They will diagnose the level, and if at all you have dry eye as a syndrome.
Perfect. We are running short of time. We'll take a few questions from the audience. Uh, Shilpa is asking, how often should I use artificial tears?
So I just want to reiterate the same thing. If the drops have been prescribed, they would have been titrated for the use of the particular person and their profession, keeping in mind. There are multiple viscosities of tear substitutes. Some are thin, which are drops. They tend to stay in the eye for shorter period of time, so they need to be used more frequently, 2 to 3 hours once. So if it is a tube form, it's a gel. It tends to stay in the eye for longer, but the only inconvenience is it makes your vision a little blurry when you're using the screen. So that you can use only 2 to 3 times a day. So the titration has to be done ideally by the patient based on their daily requirement. As less the use, the better.
Okay. Okay. So Apurva is asking, can contact lens wearers get dry eye?
Yes, contact lens wearers can get dry eye if they are not using their tear substitutes adequately.
Hmm.
Contact lenses tend to maintain a very thin film of tears on the corneal surface, so the neural feedback mechanism is cut off.
Hmm.
So the eye always thinks that it has enough water. Usually, at the dispensing of contact lenses, we always add a tear substitute in the initial days so that they continue to hydrate their ocular surface. So they have to continue to use those eye drops.
Okay. Question from Soumya, how does environment impact dry eyes? I think we addressed that already. Basava is asking, are there any dietary changes that can help with dry eye?
Addressing lipid metabolism issues, high cholesterol levels. Vitamin A is known, and vitamin D is also known to cause some amount of dry eye if it is deficient. So, generally speaking, a good general health with adequate vitamin levels in your blood test should, make sure that you avoid getting dry.
Okay. Jeevan is asking, how much screen time in a day can cause dry eye? Is there any specific number to that?
There is a very peculiar Indian study that was done after COVID to see how school children fared with the incidence of dry eye. It was not specifically tied down to a duration rather than even two continuous hours of looking at the screen can cause dry eye symptoms for that time. It will not be consistently present.
Yeah, that is very depends on individual and lot of other factors, I think.
Yeah, yeah. So main thing is anything more than 6 hours in a day
Mm,
continuously would definitely cause uh, some issues.
yes. One more last question we have. Are there any specific eye exercises that can help with dry eyes?
Eye exercises specifically would be blinking your eyes more frequently when you're using the computer or the screen, and closing it for some time so that the tear gets some time to reform to its full thickness.
Mhm.
So that would be the exercise that would be helpful. But you can't appear to be asleep in a meeting, so practically that is the issue.
Mhm. Yes. Uh, some more. I think I have one more question. I think You talked about medication also, and especially in Jogren, when we see a lot of dry eye, there are tear substitutes being used, and sometimes you use tear, you use topical immunomodulatory therapy also
Yes.
like cyclosporin. Uh, when do you decide on using any procedures like something blocking your the tear flow from the eyes?
So the thing is, evaporative dry eye is mainly because of the alteration in the lipid layer.
Hmm.
So the meibomian glands, which are destroyed by most autoimmune processes,
Hmm.
result in complete evaporation of the tears.
Hmm.
So in such a case, we don't want any drainage. That is when we do the punctal blockage, punctal cautery, or
Hmm.
no, more recently we have a conjunctival mucosal transplant, autologous. That is, it is taken from surviving cells from the other eye and it can be plastered into the current eye. So these are all the treatments that are seen in rarest of the rare cases, I would say. They are not go-to uh, surgical treatments that tend to be permanent. For that reason, we generally tend not to discuss about it unless the particular patient who has Steven Johnson's or Sjogren's in a very advanced form, scleroderma especially. So that is very, very titrated for each type of patient. So there is no fixed rule that yeah you have to do a amniotic membrane transplant or a the punctal cautery. So it is usually combined with one or two in order to make sure that some amount of the patient's tears is always present.
Hmm. Hmm. Yes, I think we have done with all the questions. We have also overshooted our time. Uh, Yes, I think it was a very wonderful discussion. Thank you, Dr. Aditya, for enlightening us about the dry eye disease, the causes, the lifestyle management, medications, diagnosis. I think all of us should keep this in mind because screen time is on the increase everywhere, and all of us are guilty of excessive screen time. So these measures are definitely useful for everybody who's watching this. So there's nobody who says that it's not useful for them. So thank you so much. Thank you once again for talking to us and taking time out. And thank you all the audience for joining us and putting in your questions. With this, we'll end our session today. Thank you all.
Yeah.